I'm going to mute you, and if you could just say your name if you're calling in via phone.
I'm saying, I'm gonna go sit right behind you there.
I want to sit over there.
Again, anybody calling in, if you could please identify yourself if you're calling in via the phone.
Mark Van Buren.
Thank you very much.
Excellent. You won't have to you don't want to unmute this. It's perfectly fine. Perfect. Great. Thank you. You folks are long time veteran now. Well, we don't either.
Is anybody going to be presenting their screen? No? No. Maybe if I knew how. Really? Okay. Or do you have any documents you want me to show them my screen? Okay. Yeah.
Okay, I'll just put it up. Okay.
Can I also get the names for the other callers? I'm going to unmute you. And we have Mr. Van Buren, but for the other two callers, if you could please state your name.
Laura True from White Sand Ranch.
Thank you very much. And we have one more
Trina
caller.
Carmelo, Desert Diamond Casino.
I'm sorry, can you repeat that?
Trina Carmelo, Desert Diamond Casino.
Thank you very much.
On the webinar. Dusty?
Yeah, I mean, our team, everybody's fine. They haven't been great this season. When's the right? So, that's the.
Yep.
Or you can log into the web.
But see, this is her, so I don't know how I can get into it.
You have access to your, or the internet on this thing?
I'm just gonna kind of sit over there and look off yours. It'll work.
I have the participant list up. So it's captured between the two of us because we will see it.
Okay, so on the phone right now, we have Trina, we have Laura True, and we have Mark Van Buren. Are we missing one?
Is this you?
That's me.
Michelle Hatch with Casino del Sol is also on the phone.
Then I'll have the,
Absolutely. And I'll move the mic over.
Thank you,
and take
Michelle.
after talk.
And we're seeing now two more. If you could please announce yourself, who's calling in?
Ross Bond, JW.
Okay, Russell Bonds. Got you.
So this one,
Grant,
so can I turn this on?
if you want.
I'm sorry, one more time?
Ross Bond, JW Star Pass.
All right, thank you, Russ. So he's number 11. And one more time, who was the other caller?
Grant Dittman from Canyon Ranch.
Thank you very much.
Okey-doke, I think we're going to go ahead and get started. If we may, we're still waiting for a co-chair, but I'm sure she'll join us in a moment. Hopefully she's making it through the health screening outside. Good afternoon. Thank you for being with you. I'm Jan Lesher. Here today, Chuck Huckleberry. We have Dr. Garcia, Diane Frisch, and a host of county staff here to help you as well. This is, I think, a particularly exciting subcommittee that we're looking at today with the expediting government regulations. As you all know, you have each participated in one of 3 task forces over the last several days relating to either bars and restaurants, hotels, motels, resorts, spas, and the attractions industry. And while there are unique characteristics to each of those, we are finding as we work through this that there are really greater areas of common interest and a lot of similarities in what we do. And so it's making good sense for us to take the work that has come together from the various groups and what we've received from all of you representing the industry and bring those points together. In a moment, I'll talk a little bit about the survey and such, but mainly just say we're so thankful for the input we've gotten. It has been consistent, and it has been remarkably similar from the various industries, with everyone saying to turning to government and asking for our assistance in facilitating ways in which we can ensure the public that it's safe and it's an appropriate time to come back into the bars and restaurants in our community, and that we're doing that with the assistance of government and not a hindrance to your continuing to provide service to the community. So with that, we want to welcome you. Thank you for being here, and I will turn it over to Brent Durad, your chair for today.
Thank you, Jan. Again, just on behalf of all of us at Visit Tucson, which is my affiliation, just want to thank all of you. So many of you are involved in the tourism industry. The fact that you've taken part in these different subcommittees, and sorry, I'm just, while I while I speak. I think this might be just a little bit easier, but I want to just thank everybody. We really appreciate your engagement in these committees. When it comes down to being able to reopen business in Pima County, you are all at the heart and soul of this. We can't welcome back visitors. We can't help our locals without everything that you're doing. So you have such a vested interest in this. I really, again, thanks for the input on that. And I want to thank Pima County as well for stepping up and taking such a strong leadership role here. For us, it's really important to see. I'm also chairing the Arizona Lodging Tourism Association this year, trying to work with, again, the state government to help direct more regulations, more guidelines out there, and frankly, they really haven't been forthcoming. With that being the case, I think really the intent here is to do everything that we can to work with Pima County to figure out, what can Pima County do to help expedite the reopenings, and taking a look at, again, some of the, whether it's, again, ordinances or other aspects out there, how can we help you get reopened more quickly and as safely as we possibly can. We've got some great reports here today. All three subcommittees have met recently, and very eager to hear, again, the recap of those summaries, and then talk about kind of what those next steps might be. So with that being the case, why don't we go ahead and just jump into the task force reports, and if I could call on Ms. Anderson and Mr. Frucci to start with the bars and restaurants.
Hello, good afternoon. This is Lonnie Anderson, the Division Manager for Consumer Health and Food Safety. Can you hear me?
Nodding approvingly.
All right, great. I'm going to turn it over to Gary Frucci, and he will start with the food establishments.
Okay, so this is Gary Frucci from Consumer Health and Food Safety. I'm going to review the Pima County COVID-19 pandemic temporary measures related to Pima County Food Code regarding reopening to in-house dining. I'll just go through the document fairly quickly, and if you have questions, we will take them. So the Pima County Back to Business Restaurant and Bar Group made the following suggestions during its first meeting. This temporary guidance applies to all restaurants and other dining establishments and will be in effect for the length of the pandemic and until all restrictions are lifted by the governor. The measures also apply to event spaces and catered functions. Compliant with such standards is to be validated during regular operator inspections. All establishments that document adherence to the minimum best practice standards below will earn a Pima County Best Practice Pledge badge that can be displayed electronically or physically to provide a visible symbol of the commitment to the community's health and well-being. So minimum employee, vendor, delivery service, and patron health and wellness measures. Number one, wellness symptom checks, including temperature checks for all restaurant personnel, vendors, contractors, third-party delivery workers, et cetera, as they arrive on premises and before opening of a restaurant. Cloth masks and gloves and frequent hand washing is required for all servers and restaurant personnel, except gloves are not required for servers if hands are sanitized between servings. Number three, any patron exhibiting symptoms of COVID-19 is prohibited from entering the facility. Minimum restaurant operation measures. Number four, physical and electronic signage posting at the restaurant's entrance of public health advisories, prohibiting individuals who are symptomatic from entering the premises. Number five, indoor occupancy is limited to 50% or lower. 6, service by takeout, reservation, or call-ahead seating only, including text and/or telephone notification patrons requesting restaurant in-person service, allowing restaurant patrons to physically distance until called for service. Number 7, physical distancing of 6 feet minimum between tables. 8, clearly marked 6-foot spacing marks throughout the restaurant along entrances, hallways, restrooms, and any other locations within a restaurant. Parties, number 9, parties no larger than 10 allowed per table. Number 10, menus must be in a format that does not promote potential virus transmission, for example, menu boards or single-use menus. 11, elimination of self-service stations, including salad bars, buffets, soda refill stations. 12, expansion of outdoor service areas to increase physical distancing standards. 13, hand sanitizers available at entrances to the facility, restrooms, and in employee work areas. 14, sanitize customer areas after each sitting with EPA-registered disinfectant, including but not limited to tables, tablecloths, chairs, booth seats, tabletop condiments, and condiment holders. 15, post documentation, cleaning logs online and at the entrance documenting cleaning of all public areas, inclusive of countertops, door handles, waiting areas, etc., at least every 2 to 3 hours. And additional measures to consider, number 16, implement touchless payment methods. Number 17, restaurant personnel will have to have a national certification in food safety and handling, as well as specific training in the prevention of COVID-19. Anything else? Questions?
For the use of you in the audience, we're missing page 2 in the handouts, so we need to get that added. It goes 1 through 10, and then it's missing page 2. So I don't know if this is a coalition problem, or yep. Do you have page 2? Yeah.
Are there any questions for Mr. Frucci? Mr. McCrary? Oh, thank you. Ms. Lesher, do you have survey recommendations or results you'd like to share? Thank you.
As I think you're aware, between May 1st and 7th, the county has conducted 2 different surveys of the public to try to get their input about what's going on and what the sense is about physical distancing and other kinds of consumer and customer-related services. It's interesting, the first survey was up for just about 3 days, and we received just under 4,300 responses. I'm like you, I think while I'm talking, I'm going to take it down for a second. And we received them from every zip code in the county, so we got a lot of good support to that. We asked a variety of questions about restrictive measures that restaurants might employ and how the public felt about those. There were 9 different options for various physical and employee services or measures that might be preferred. There was a 10th option that was offered, which stated that no protective measures are necessary. Less than 17% of the public chose that option. So the vast majority chose any one of amongst a variety of measures they preferred. The first was wellness checks of restaurant employees. That received the most response at 68.5% of responses. The second being the 6 feet distancing, and that was just about 66%. All of the responses to this, to the various survey questions are provided on the B2B website, so there's information there. The second survey is ongoing. We just started it yesterday, I believe, and as of 8 o'clock this morning, we already had about 4,300 people responding to that. The interesting part of that one is we were asking people whether information that they thought about how the patrons should be responding and how they felt about issues was extremely important or very important, and at this point, extremely important leads in all 17 measures. We tried to get a sense of those initial bucket of survey questions, then to rank amongst and between them to have people identify is having the temperature taken by an individual important, very important, not really important. And everything that people thought of the initial group of questions was important for consideration or might be health and safety measures for the public is receiving extremely important as a response. Again, that one's not closed yet, but we're trying to use that feedback to help guide us in terms of how we scale in what kinds of services we're providing to the public as well. That survey, the second survey, is still online, and if you go to the B2B, to the COVID-19 website at Pima County, you can then find under the Pima County Back to Business link under our Expediting Government Regulations Task Force, you'll see those surveys. And still plenty of time for people to respond to that. But I think if there's a bottom line takeaway, the vast majority of the public believe that there is a need to reopen using some sort of protective measures with employees and patrons, and that those are the ones, those who feel that there is a need to have those measures believe it is extremely important that we have those measures, none of which at this seem to be onerous, and all of those that we've tested seem to be very consistent with the kind of measures that have been promulgated by the various task forces. Okay. Thank you.
Very good, thank you. And I didn't coordinate with you prior, but I was thinking if it's okay, if we have folks in the audience or online who'd like to make comments about the recommendations, would welcome those.
At any time.
Yes, sir. If we can just, I believe this mic will be live up here, if we can have you come up. Thank you.
All right, folks, can you hear me all right? Can I remove this temporarily? Thank you. All right.
And can you please just state your name?
My name is Sean Humphrey. I'm a United States Air Force veteran. I'm also the owner and partner of John Henry's Bar and Freight Train Coffee Company in the city of Tucson. So before we get started, I'd just like to hand out some materials that I printed out for you guys. Keep it short and sweet here.
Why don't you just leave them with me, and I'll do it for me. Thank you.
And there are some extra copies. So once again, I just want to start off, say thank you for being included in this process. So Jan, just as you have sent those surveys out to the public, which is awesome, their input is always, one of the most important things we can have here in the community. I too have done my due diligence in the time between our last meeting and this one. I have consulted many bars in the city and the county, respectively. I talked to over 20 owners individually, and I received input and data from 12 respectively. Here, just as an example, I have, in their own words, a small sampling of their safety concerns, stuff they would be willing to implement, and general questions they had for the county itself. Now, during this process, we were using the materials provided at the last Back to Business Task Force meeting, as well as the CDC guidance for the COVID Stop the Spread of the Germs brochure there. So without getting too far into the weeds here, if you look at that first handout that I handed you, titled Attention Pima County Staff Back to Business Task Force Members, that covers two categories. I tried to make it very simple for everybody here. We have safety steps that we're willing to implement following these guidelines, and then we have general questions and concerns. Some of these are exceptionally valuable because they haven't really been covered by the government on any level thus far. So if you get a chance, please look at those. The second issue that I wanted to address here is I received the memorandum dated May 5. I believe everybody has that in their Back to Business Task Force packet right here. It's on the second page. But there was a little bit of confusion because I received this, and it appears absolutely that the county is treating bars and restaurants as if they are going to open at the same time and that they're on the same playing field. I'm going to sound like a broken record here, and I apologize, but that's the only thing that we're asking for, is for the same fair and equal treatment with eateries that have dine-in facilities and also sell alcohol. That being said, I received a follow-up email, and I have that here. I received a follow-up email from Amanda Anderson, and it was addressed solely to me, but this is where we kind of ran into some confusion here because this felt like it was almost backpedaling on the memorandum, and this is stating that no bars are not included, and that's a governor's issue, and at the end of it, I was encouraged just to reach out to the governor himself. So what I'm looking for from the county is, where does the county stand on this? Are we considered with our brothers and sisters in the restaurant industry, and will we be afforded the same choice as them? I'm not trying to chew up all your time here. I just wanted to let you know that we're still here. We just want the option to reopen with restaurants. That second document that I gave you was provided to me from Detective Zacharias from the Liquor Board, and he said that the Liquor Board was going to be reaching out to Governor Ducey's office with a memorandum here very shortly, stating that if a bar has the ability to provide dine-in services, that the state would perhaps see us the same way. If you have any questions further on that, I just got off the phone with him about 45 minutes ago. Please feel free to contact him. But every piece of information that he gave me is coming straight from his supervisors and the director of the Liquor Board, so hopefully we'll see that memorandum soon. That's what I have for you all. Once again, I just wanted to provide that information to all of you and tell you that we still want to be considered with restaurants in the reopening on the county level. Now, if the state goes ahead and does that for us, great, but I would really like the county to support us on this. Thank you so much, guys, for your time.
Yeah, let me try and answer the question. We put bars in the restaurant group because you do things that are very similar. And I guess if we made a mistake, we said the bars and restaurants as of the May 11th opening, and that was just an oversight on our part. Again, we consider the things that you do somewhat similar to restaurants, and therefore you're included in the package of these particular proposals for best practice standards. It's really up to the governor as to whether or not he includes you or not, and it would be great if they would actually provide that clarification, particularly for bars that provide meals. There's probably a few out there that sports bars and the like that do provide meals at the same time they provide alcoholic beverages. So that's the gray area, and hopefully the state will clarify it.
I do have one question. I guess it would be better suited for Dr. Garcia, but looking at the article that was published today in the Arizona Daily Star, there was a little bit more confusion on the part of, I just would like to get a medical professional or a county professional to kind of explain to me how a bar that's located inside of a large eatery, let's take Buffalo Wild Wings, for example. How is that safer than a standalone bar? There's much fewer moving pieces inside of a bar than there is at a restaurant. We have much fewer staff. There's less people sitting together in large table groups that are parties, for birthday parties, things of that nature. And I'm just a little curious about how we're coming to that decision where restaurants that have these bars are separate.
Yeah, I think we'll let Dr. Garcia address it, and again, I think it's really something the state needs to clarify.
Excellent. Well, thank you so much, and before I go, I'll drop off one little document here. It was provided to me by an employee. His name's Brian. He works in town, but he just had some personal questions he'd like answered, and I'll drop that off at the end of this for you guys.
And Dr. Garcia, did you want to comment?
Sure. Chairman Dredd, Administrator Huckleberry, Mr. Humphrey. So the conversation that's happening at the state isn't so much about bars being at higher risk, but rather the actual bar surface type of accommodation. What I can tell you is that the conversations that are occurring right now, at least with some of our friends at the Department of Health Services, are that bar counter may not be included, potentially is not going to be included for restaurants or for bars as a serving space, and that's what's under consideration as they consider whether to allow bars to open up operation. That is the only piece that is really different, and that would apply to restaurants that have bar top service, by the way, because it's not just bars that have bar top service. There are also many restaurants that have bar top service. So that bar top service is where the social distancing can't be achieved, and that's the only area that is significantly different.
Dr. Garcia, just for your own, your personal knowledge, the copies of those documents that I gave, the recommendations from the 12 bars that I did get input from, we had a roundtable either via text, email, or in person at a socially distanced meeting. We do have that addressed in there, and that is one of our top priorities. That was kind of the first gee whiz thing that we were on. We need to have a set, quick, and reliable time schedule to use a denatured bleach or some other type of eco-friendly product to quickly clean, disinfect that bar before another round of drinks goes out, or use glassware comes back in. So we did have some foresight there, sir, and like I said, please feel free to grab a copy of that for yourself, Doctor.
Thank you, Mr. Humphrey.
That's all I have. Thank you.
Any committee members with us today or online who'd like to make any comments about the, again, the recommendations that have been put forth at this point in terms of bars and restaurants? Mr. Blumenthal.
Thank you. I'm recalling when I completed one of the surveys, and it was one that had the question about seating or groups. I don't have it in front of me, but what I recall was that the question dealt with is a group of 6. Would you, how would you feel about that? And what I think I just I recall in number 9 on page 1, parties no larger than 10. So I'm curious as to what information led to the expansion of the number, and is the number of any group considered any group of individuals, or are they all a group from a same family unit? Thank you.
Dr. Garcia, do you have any comments on that?
Absolutely. Chairman Durad, the bottom line is that between the survey that we issued right after our task force and this meeting, the governor issued his guidance. His guidance includes specifically the number 10 in terms of the maximum size of the party. And that is the reason why, in order to not be in conflict with that number, we decided to change in the draft that was submitted on the 5th of May, the party size limit to be a number of 10. And it would be any 10 individuals that were part of that party at that one table.
I'd like to ask a quick follow-up question, and that is in another memo I read by County Administrator Huckleberry. At least when I read it, I'm not sure how recent it was, but it was still unclear the jurisdiction of the county relative to having greater specificity on whatever rules that the state may come forth with. And I'm just curious as to where, if that's been in any way resolved or better understood. Thank you.
Yes, let me clarify that. If you looked at our first draft, we just had something that said temporary regulations, and those temporary regulations have now been changed to something called best practices. And so our perspective is that we probably do not have the authority to exceed the state's requirements, but where the state's requirements are vague, we can fill in the detail. And so we fill in that detail with something now called best practices. And so there's the difference. And so you hit it right on the head when you picked out 6 and went to 10. Well, the only reason we changed that is because we can't basically supersede the state's specific requirements. But when the state talks about social distancing or physical distancing and they don't give you any real numbers, we do. Same thing with cleaning, we do. We give you frequencies and types and that type of thing. So there's the difference in what we're calling ours are best practices, and they get specific when the state is over here being generic.
Very good, thank you.
Other comments and questions related to the bars and restaurant recommendations? Ms. Storm?
Can you hear me from here, or do I need to go up there? Let me get you a mic.
Okay.
For those who are online.
Thank you. Priscilla Storm, Old Tucson. One of my questions about this guidance, is there any distinction in terms of capacity? I'm not talking about the social distancing or the spacing, but for the outdoor eating areas relative to the indoor eating areas?
Let me clarify that. That's why we've included in some now of our regulatory actions measures to increase what we call the premises requirements, so that really the limitation is only on the indoor seating area. And so I hope we were clear where we said indoor 50%. Yes, it says 5 indoor occupancy limits 50%. No limit on the outdoor as long as you can maintain social distancing.
Great, thank you.
Any other bar and restaurant comments?
We have one online.
Oh, bring the mic.
We need, microphone. Ms. Powers.
Okay. Sure.
Hi, good afternoon. Thank you. My name is Amanda Powers. I'm the president of FC Tucson, the professional soccer team here in town. We are still in season suspension and part of the phase 3 of reopening. I'm just really curious, and I appreciate the point about jurisdiction and authority on these matters. This, to me, is very much a states' rights issue, and obviously the governor has those, that jurisdiction. And I believe that the medical data is being collected on the county level. And if there is an ability to be able to act quickly, be agile, and be able to collect real-time data on these matters and adjust as we continue to evolve out of this pandemic, which could be up to a year, 18 months, realistically. I think it's very important that we distinguish who the governing authorities are on these matters, and we agree to who those are, and that it's consistent. Secondly, I would ask that we establish where our medical opinions are coming from, and that we agree what those medical opinions are. If it is, in fact, the CDC, then we need to say that. If it's the state or the county, we need to say that. But when I look at this criteria section here, I'm very unclear why we're opening on May 11th if some of these criteria have not been met. And I don't understand why we have it if we're not going to adhere to it. And so rather than continue to, and I look around this room, and I think this is the future that we have to look forward to here. And many of us have had to take our masks down to speak. This is an aerosol spread disease. So if somebody's sitting at a table and chews with their mouth open, I cannot imagine that we're going to return to anywhere over 50% of what we're used to doing in occupancy rates. And we've modeled that in our stadium events. And it's only 23% capacity. So when you start to look at a 23% capacity at a stadium event or a restaurant, and then you add these additional requirements, well, they're not requirements, it looks like, they're suggestions in some of these cases, and there's no real governing authority or a shared set of facts or a shared set of medical data that we're all working from, or actually, and also enforcing, which I see as the big problem. We're going through these exercises, but how do we account for people in this? And so ethically, this is again, I had said this in the call on Tuesday, I want to reopen, obviously, but we've seen the graphs. We've seen what a return to opening very quickly can do in spiking the spread. And so if you think people are eager to get back now, they have a dining experience, a movie experience, a sporting event, a hotel experience, and it's not what they're used to, they might say, you know what, I don't want to go. And that's the future that we're talking about here, is that events as we know them, whether it's dining out or going to a bar, and all of this regulation and mask wearing, which I believe in, but I choose to stay home as much as possible, is going to change all of our experiences. So I was curious what on the restaurant side, just as we have done in the sports side, I sit on several task force on a national level, and we've been talking about these things for 6 weeks. And testing and contact tracing is very paramount. And so if we can't agree to a set of guidelines here and operate with them, then this isn't, how can we plan? And then how can we ensure that these are going to be followed up upon and that there's equity? I cannot imagine a restaurant having to now hire someone to go wash down a handle after somebody's used it. Sitting in a restaurant like this. And so I guess I would just be really curious or I would encourage that the county be clear in saying what the jurisdiction is and the authority on these matters. What is the medical expert that we are using so that we can all work towards those same goals? Or is this just a matter of, well, too bad, so sad? And there is one piece in here that there was one thing, I think it said something about somebody symptomatic and they're not allowed to come in here. Well, we know that asymptomatic people exist all over the place. And that's why there's the need for testing and why there are different types of testing is so important. And so how can we in good conscience, ethically, say, oh, well, I don't have symptoms, but you don't know if somebody who could be a very spry 60-year-old person who gets an aerosol from a dinner conversation and gets sick, and you have no way of really knowing. And then there's the accountability piece. I'd like to see as many graphs on both the economic, I had mentioned a cost-benefit analysis, I would love to see that, of what would happen if there could be rapid testing come July, should we continue to hold back? My concern is, and in the nature of our business, and like many events, and restaurants here who are dependent on events coming to the city, is that it takes months to plan ahead. So if we have continued outbreaks, or people are fearful of traveling, or people are fearful of going out, this rush to doing things this way and spending all this energy into hand sanitizers and enforcement of social distancing, how do we know that that's actually going to save your business today? And I have done my own financial modeling, and we are looking at 3 scenarios, and one of them is to continue to play at Keno, but not with 400 people there. And then obviously all the other unknowns at this point were a phase 3. So in fact, if we're following this, we would be a phase 3, which you assume would be in August or September. So again, it's really difficult from a business perspective to try to plan for these things if the facts and the evidence and the guidelines that we're using are different than what we're being shown here. So I have a list of questions, and I think I had sent it to a county administrator about 2 weeks ago, and I believe that they had gone to Dr. Garcia, just outlining these basic questions. What do we know about the transmission? Because I see this as a major educational issue as well.
Ms. Powers,
yes,
I think we can at least start to address at least some of that here, if that would be okay.
Sure.
Let me just give you my perspective on it. When it comes to, and one of the reasons I'm excited to be sitting up here today is the fact that Pima County is actually taking a leadership role in this. We were told, I think, in no uncertain terms by the governor through his executive orders that the ability for counties and municipalities to go beyond where the state is in terms of regulation, it's just not there. We have to follow the state's guidelines on this. And I'm just going to be candid with you. I really have not seen much come come forth. Even things like, Ms. Storm asked a great question in terms of capacities. So we at least have some guidelines here in terms of what we can do on the capacity front. But I've seen nothing come forward from the state other than the fact that, again, where they're at now is no more than 10 people can gather at any point in time. I think what we're trying to do here is come forward with at least best practices that all of us can put forth just to try and protect, certainly our business owners and our patrons as well. When it comes to these dates of reopening, May 11th, that's a date that was set by the state. Pima County has no ability to impact that date, and we can't push that date backward from that perspective. And so just to give you a little bit of background, we're really, I think, beholden to the state. And let me turn it over to Ms. Lesher and Mr. Huckleberry.
Yes, we have another group called Road Recovery that met this morning. That's all physicians and physician managers who really are looking at the data and saying, where are we and what best practices should be implemented to minimize either the spread or the recurrence. And so, we're going to basically provide that information not only to anyone who's in this particular region, but also the state, so they have a clear understanding that we're taking some opinions of experts with regard to the issue of reopening and how quick and how fast. But I think the fact is that the statement's been made that on May 11th, the restaurants are going to open. So then it's up to us to look at the state's rules, and they look fairly generic for restaurants. And where they're generic, I think we can fill in the details that really provides what we would call the best practice to give some credibility to individuals who want to come to a restaurant that they're not taking an undue risk. And that's all we can do, is we're trying to figure out how to minimize that risk so that the public has some confidence in coming back and to a restaurant. And that's really about all we can do.
And if I may, I think that the chart that you're referring to that Pima County has posted that shows the 9 elements was our attempt initially to begin to look at managing expectations into the community. There was a great deal of discussion about why we were closed, when we could open, what could possibly be true. We picked 9 elements that are consistent with national and federal guidelines out of the CDC, as well as the state, and said we are encouraging people to just look at that were wondering why we're even where we are. And if you look at some of the basics that everyone's agreed to of, has there been a consistent decline in hospital, is there capacity in the hospital beds? Is there a steady decline in the number of people in the positive unrelated cases? There's some basic criteria that people can look at. Our attempt is, and if you, in the chart that the county posted just said that's what it's going to take just to get to really the end of phase 1. So just to help people begin to understand what is the science, what is the criteria that's going to have to be evaluated, didn't necessarily give you the tools to do that other than to provide the matrix that everyone can look at together as a community. People right now are calling us and wondering why we don't get open, and you can look at that and say out of 9, I think over half are still red. So until we have some of the basics of just being able to account for that, we're not going to move to the next standard. So our attempt was not to have something that was contradictory in any way, but simply led into the first phase that, as Chuck has mentioned, is based on the science that doctors across the country have agreed to.
Okay, so if I understood what you said, is that we're still in phase 1 because this criteria is not met, but we are opening certain businesses as of May 11th. Correct.
With certain criteria.
With certain criteria.
Correct.
And what is the current, I didn't see the graph this morning, and maybe Dr. Garcia can speak to this, but what is the estimated timeline that we would move out of this phase 1 right now for Arizona?
Dr. Garcia, I don't know what, no one has a date that I have seen, but.
Chairman Drad, Ms. Lesher, you're absolutely right. The modeling is all over the place in terms of when we will be on the downside. What I can tell you is a couple of things. There's pretty good consensus across a lot of different groups saying that, at least for Arizona and certainly for Pima County, that we have reached the top of the curve. And so that is a piece of very good news. We also know that some of our indicators are definitely moving in the right direction in terms of the new cases and the new mortality, the new deaths that are reported. We know that those things are improving. But to give you a realistic timeframe for when we will meet all 9 of those indicators, I don't know that we have the information on which to make those estimates. The models that are being talked about nationally are all over the place. Some of them say that we've already weathered the worst part of the storm in Arizona, that we are on the mend. Others project this not being over till the end of June. So we need to prepare for a variety of different circumstances, and we need to have our surveillance eyes very clearly focused on these indicators so that we can pull back, or at least so that we can provide that information to our community.
Thank you, Dr. Garcia, and that's why I would also encourage us at the county level. Since the national indicators are all over the place, it behooves us to look more locally here and how we can shape a better recommendation and best practice for that. Thank you.
Thank you. We have online Nicole Dahl. Nicole, can we hear from you, please?
I just want to commend Pima County and the city of Tucson for, taking the hand that we've been dealt and doing the best as possible with it. And I do have 2 questions. So we have a hotel with a bar in it. And on these, I'm looking through all of the links that you sent to us, and I'm just wondering if somebody can explain whether these are regulations or guidelines, or a little bit of both. And then my other question is just on employee safety. Everything I read, whether it's a guideline or regulation, seems to keep the guests and customers safe. But if you're an employee and you're wearing a mask, but we've been told by the CDC that the mask is actually just keeping your germs to yourself. It doesn't protect you. The only way you can be protected is if the other person's wearing a mask. And we're inundated with that information online. Whether it's true or not, I don't know. I'm not an epidemiologist, but. So how are we to tell employees that it's safe for them to serve unmasked people at a bar, or if you own a restaurant? How is that working?
Dr. Garcia?
Chairman Drad, Ms. Dahl, so you raise a really good point, which is that cloth face coverings are really for the protection of others, right? And that one of the things that people are challenged to do is what happens when your social interactions involve people whose mouths aren't covered. It's hard to imagine in a restaurant setting how you would sort of keep the cloth coverings on your face. What I can tell you, and this probably gets more to the next agenda item, which Gary and Lonnie were going to review, which is about pool and lodging. I think what we're seeing across the community in terms of the expectations that are being set on customers on the part of the hospitality industry, a lot of it is around the social norm of wearing masks. And I think every business has the ability to ask that their patrons wear a mask. Wynn Hotels in Vegas, as part of their corporate policy, is instituting something like this and are giving masks out at the time that customers come in. And that is certainly covered in the guidance that we have. We did think, though, it was a little tough for restaurants to require that of people seated in tables.
And Ms. Dahl, if I can, let me try the first part of your question as well, which you went back to. differentiation on our website of what's regulation and what's guidelines, and so it sounds like, A, we need a little more clarity with that, but so much of what we've been looking at now, there are regulations that are required under the code, but a lot of what we've been working with all of you in the restaurant and our industry partners is to find out what are those guidelines, which are really the suggestions. What is it we're going to look at that we can begin to establish as best practices? What is it that we can recommend to you as businesses that is clearly based on what the community may move into the area of feeling more safe and confident returning into the restaurants? So some are guidelines and suggestions, best practices, and some are specific regulations established in code. If that's not clear in looking at the website, then we'll make sure that we've made that distinction. Thank you.
Thank you, Ms. Lesher. Can we go to Janos Wilder, who I believe is on the phone?
Can you hear me? Yes, okay.
Yes.
So thank you so much for taking my call. I share the frustration of many who have been calling, and I share what I perceive to be the frustration by some of you on the panel. The frustration is born of a premature decision made in Phoenix to allow selected businesses and restaurants open next Monday. I made that opinion clear to you that I think that is way premature. But I'd also like to have better guidance on when it will be safe. Clearly, the state has not followed the guidelines that they established for themselves, and nor that the county established as well. So restaurants like mine and businesses like mine that will choose not to open on Monday find ourselves sort of out on a limb without good guidance. While I think that we will have the guidelines in place internally in our places of business, in our restaurants, to serve the public and to maintain our staff safety as well as possible under the conditions, but we want the conditions to change. We'd like to see the curve going down so that we are not at as high a risk as endangering ourselves or others. So if you could kind of elucidate a little bit better, a little more clearly, what we ought to be looking for before we reopen.
Mr. Oseran, did you have a question or a comment that's similar in nature that maybe we can answer jointly?
Yes, I have a comment and a question. The comment is just a point of interest. 100 years ago, when the Spanish flu, as it was named, took place in Tucson, Arizona, you had to wear a mask within the city limits. It was against the law, and you could be arrested. There was also social distancing, and almost all the things we're putting into effect were in effect 102 years ago, which is kind of interesting. But my question is to Dr. Garcia, in follow-up to Janos and in follow-up to the modeling. I'm wondering if you've had a chance to review the modeling of U of A and ASU, and if you have, what were they recommending as far as reopening, date of reopening?
Chairman Durad, Mr. Oseran. So we've been following the modeling of everybody that we can get our hands on. Understand that models are really dynamic, which means that on a week-to-week basis, they look really different. The recommendation that the ASU U of A group had was a end of May kind of beginning of loosening of restrictions. So understand that when you model, it's an exercise in a probability. So you're saying, what if people start to have slightly more interactions? Well, that's not the way people really behave, right? We don't know what's going to happen on Monday when restaurants are open. We don't know exactly how many are going to be at their 25% capacity or 50% capacity. But their conclusions was that reopening before May my interpretation of their conclusions was that reopening before the end of May was premature. In terms of future cases.
Thank you.
First, Mr. Humphrey, I'm going to go to, we've got Michelle Conklin online with her hand raised. Ms. Conklin, did you have anything for us?
Sorry, no, I must have pushed the wrong button, sorry. I have nothing to add at this point.
Thank you. Let's go back to Mr. Humphrey.
All right, ladies and gentlemen, I don't want to take up any more of your time. I know we need to transfer to another task force here, one of the other three. But I did just want to close with this. There are a ton of unknowns right now, and this is way bigger than me as an individual, you as individuals, even certain governmental departments. There are excellent concerns that were provided by the Tucson Football Club. Those are awesome things that we need to understand and know moving forward to this. I just want to reiterate that my role here, and I'm speaking, not only just on my behalf, but trying to be a voice for these other establishments. The only thing that I am trying to advocate for here and now is just the same rights and abilities as restaurants. And I want to reiterate as well that there are certain bars and restaurants, they're not comfortable reopening yet. That is absolutely fine. That is an ownership and a staff decision. Those that want to open should have that ability. Just in closing, there's a lot of wrong answers these days, and there's not very many clear right ones. And as terrifying as the situation is, we walk this awful dichotomy. Right now we can't afford to stay closed forever, because if COVID doesn't kill our bodies, it'll certainly kill our businesses, but we can't afford to risk the public health, and we can't afford another closure or another outbreak down the line. That'll certainly, kill off many more businesses. I wanted to say thank you again for being included in this process. All of the safety measures that we are willing to implement, I would love for all of you to review those, and our questions we have here, if somebody can get back to me so I can forward that to these respective owners, just so I know that Pima County is listening. And we all want to get back to business, but safety and ethics and morality has to come first. And I just wanted to get all of these questions and concerns to you guys on behalf of these folks. Thank you.
Thank you, Mr. Humphrey. Is there anyone else that would like to speak on the issue before we move on to the next task force? Mr. Blumenthal.
Thank you, Chairman Durad. Just a question, and that has to do with contact tracing. Now, that isn't specific to any one task force or subcommittee's work, but at the end of the day, it speaks to identifying sources of infection or places where infection may have occurred. And particularly in public settings, such as restaurants, bars, gyms, what have you, it would be pretty traumatic for a business to be identified as the business that was a source of the virus. So my question is, to what extent has the county or its surrogates mobilized to do contact tracing once things open? That's number one. And number two is, what has been the discussion or the expectation should a source be found to be a critical or a significant source at a particular time for infection? Thank you.
Chairman Durad, Mr. Blumenthal, that's a super good question. And first, just to make sure that we're all on the same page in terms of what we're talking about, how the process works. When you go get a test for COVID-19 or for any other thing, that result that specimen is sent off to a lab, and the lab runs a process and sends a result to your physician or to your nurse practitioner. She then calls you and provides that result to you. If this is a disease entity that is supposed to be, by law, reported to the state, then the laboratory generates a report to the state. And that process is a multi-day process. So you may well know that you were positive long before the state knows that you're positive and long before Pima County knows that you're positive. At the point that we receive that report, that's the point where we start the contact tracing process, because we don't get those results directly from laboratories. Those laboratories have a feed that goes automatically to the state. And so there's always going to be a lag time there. I can tell you a couple of things. I can tell you that we've gone from having approximately 10 to 11 people doing that contact tracing job to approximately 24 folks doing that, plus some trainees from the College of Public Health, plus some volunteers. So we believe that we are geared up to do the contact tracing so that as soon as we are notified, that we start that process. Understand that the information that is sent to us from the state is sometimes incomplete, and the only thing it will have is a name and a date of birth, your name and your date of birth, and the doctor that ordered it. And so there's some legwork that needs to be done in order to figure out where you live and what your phone number is and what your address is. So I think that's part of the challenge. You're absolutely right. Nobody wants to be the entity that's associated with an outbreak. I can tell you that the only clusters that are occurring currently are in nursing home and long-term care and assisted living and congregate housing kinds of facilities that take care of older folks and folks with medical fragility and compromise. So that is where most of those clusters of cases. Most cases that we're seeing today are onesies, not even onesies and twosies. They're individual cases that are happening kind of at random from random contacts that are occurring. There's an animation on our website that very nicely shows how cases are popping in and out within the county. Overall, I can share with you that our overall case count is better. And Dusty, I don't know if I'm able to share my screen or not, because I think this is what you're getting at. Okay. So, and I think this gets to Ms. Powers' point 2. Can you see that? So this is, what you're seeing here is a graphic that shows, Mr. Chairman, Mr. Blumenthal, what you're seeing here is a graphic that shows the number of cases as well as the number of deaths since the beginning of this pandemic. We break it down by weeks, but week 10, MMWR week 10 is March 1st through March 7th, and we go from then forward. And so you can see the progression of cases in Pima County. You can also see why we're believing that we are starting to improve overall in terms of the overall case count. The solid line is the actual number of deaths, and that is using the same using the same axis as we're using for the counts, just to give you a relative idea of how many deaths to cases we have. And I think that, again, the story that we're telling here is that even though it's a lagging indicator, it appears that on a per week basis, the death counts are getting better. This is what the number of lab-confirmed COVID-19 cases on a day-by-day basis are looking like since the beginning of the epidemic. Realize that our first case was on the 4th of March. And this is how it has progressed. You always see this kind of sawtooth because this is actually the date that the test was collected. And so those 2 days that are always low are weekend days because most people don't get tested on the weekend. We always tell people to disregard the last 5 days because of reporting delays. But you can see that even disregarding the last week, that again, the trend in terms of the number of cases is in generally the correct direction. Again, this is all with the proviso of the existing level of social distancing, and we are all saying the same thing with regards to that. The final thing I will share with you is this is the number of COVID-19 deaths by the date of the death. Again, disregard the last 5 days because, again, there's a reporting delay. But what you can see is overall, we appear to be on the mend. Just yesterday or the day before, we reported something like 18 cases, an increase in 18 cases. Realize that those 18 cases were spread out from the beginning of April to the current day. And so that's why sometimes those numbers really look dramatic, but on a day-by-day basis, the number of decedents is actually very, very modest. Still a tragic loss, is still a bad thing. It's still something that we're trying to get our arms around. I thought this information might be helpful, but I'll turn the control of the screen back to you, Dusty.
Dr. Garcia, thanks so much. Is there anything else before we move on to resorts, pools, and spas? Okay, let's go ahead and move into that area then. Ms. Anderson and Mr. Frucci.
Hi, good afternoon. Can you guys hear me?
Yes.
Okay, great. We will definitely start with the guidance for reopening of, just make sure I pull up the right document here. I apologize. Oh, it's a Word. Okay. I apologize. I'm trying to maneuver my many screens here.
That's the right one.
Yeah. So the document we're going to go over would be the guidance for back to business for resorts, pools, and gyms. I also want to just remind everyone that we will also be providing a checklist for reopening. So we discussed that at the last meeting. There is a checklist about what each of these aquatic facilities for semi-public pools and spas and splash pads would be asking them to do before they reopen. And part of that important thing would be ensuring that the equipment and filtration system is functioning properly, the disinfectant is at the levels, appropriate levels where they need to be, and posting the signage about employees being ill. I won't go too much into that checklist, but I just want to make a reminder that even though you see the documentation related to temporary measures related to pools, fitness centers, and resorts, there is some additional information we're going to provide related to a checklist for reopening those aquatic facilities. But we'll move to the document related to pools, fitness centers, and resorts. Not going to read the top part of the document in terms of saving some time, but it's basically the same information related to guidance applying to public and semi-public pools, gym, fitness centers, hotels, and resorts, and it will be in effect for the length of the pandemic until all restrictions are lifted by the governor. So also that there will be separate guidance provided for permitted restaurant and food services that may apply to this group of operators as well. We just went over that information. And for pool operators, compliance with such standards is to be validated during regular operator inspections. All establishments that document adherence to the minimum best practice standards below will earn a Pima County Best Practice Pledge Badge that can be displayed electronically or physically to provide a visible symbol of the commitment to the community's health and well-being. So minimum employee and vendor, and actually there is going to be a modification made to this document. It does say guests here in terms of health and wellness measures. This is really intended for the employees and the vendors of these establishments and more of a recommendation for the guests, but the minimum wellness symptom and temperature checks for all personnel, vendors, contractors as they arrive on the premises and before opening of a pool. So it does say guests here, but that will be modified moving forward more as a recommendation. Intention for sure is that the employees and vendors visiting these facilities as far as a vendor would have a wellness check. Cloth masks and gloves and frequent hand washing is required for all staff. And then minimum operation measures on number 3. Physical and electronic signage posted at the pool or gym entrance of public health advisories prohibiting individuals who are symptomatic from entering the premises. And number 4, indoor occupancy limited to 50% or lower. Number 5, clearly marked 6-foot spacing marks at entrances, hallways, restrooms, and any other location within the gym or pool. Number 6, physical distance of 6 feet minimum between fitness equipment, deck loungers, chairs, and or tables. Number 7, elimination of self-service stations including water and or refreshment. And number 8, hand sanitizers available at entrances to the facility, restrooms, and in employee work areas. Number 9, sanitize customer areas after each sitting or equipment use with EPA registered disinfectant, including but not limited to tables, chairs, loungers, and other high-touch surfaces. And number 10, implement cashless and or minimal touch payment methods if possible. Number 11, post documentation, cleaning logs online and at the entrance documenting cleaning of all public areas, inclusive of countertops, door handles, waiting areas, at least every 2 to 3 hours. And that's the end of that document. Does anyone have any questions?
Questions or comments regarding the proposed best practices? Ms. Calhoun, do you want to come up to the microphone?
Mr. Durad, thank you. Hello. I don't have a copy of that document. It's not in there. Are you able to provide that to me or to us?
And I did not see it in my packet as well, so we need to provide that.
Okay, this is totally for my second job. Thank you.
Understood.
We can provide those, but the documents are also on the website.
Other questions, comments? Ms. Storm?
I don't want to go up there.
Or can we get a...
I think I can be heard pretty easily.
Well,
Ms.
WebEx.
Okay.
We'll give you the...
Thank you. Yeah, okay. One of my questions about the signage in each one of these categories is, there's 20 to 25% of the residents of Pima County that have Spanish as their primary language, and for those of us that really work very hard to attract tourism from Mexico, whether there's been consideration about any kind of requirement that the signs should minimally be in both English and Spanish as we deal with this public health issue.
Ms. Storm, we don't have a requirement yet, but I can tell you that we are ensuring that all of the publications that we're providing through Pima County are in English and in Spanish, and we're encouraging anyone that wants to download those materials, and we have a full communications committee that begins to meet tomorrow, but we are looking at all of the guidelines, all the best practices. Every document we mentioned to you will be online and able to be downloadable for any business in the community, and they'll be in English and in Spanish, as well as all the social media, all of our advertising, both in English and Spanish.
Yeah, and I think that's terrific, but in our working committee in tourism and attractions, that bilingual aspect didn't come up, and it was just when I was thinking about pools or public pools, the light bulb just went off and said, for those of us in the private sector, we need to be thinking about that.
Sure, and hopefully anything that you're going to need, at least a model, will be provided in Spanish on this website when we get them out. Thank you.
Thank you.
Other comments? Mr. Blumenthal.
Thank you, Chairman Durad. Just a question, and I may have missed this in an earlier subcommittee meeting on aquatics facilities and lodging, and I didn't see it in a report, but again, I may have missed it. Is there any specific recommendations relative to outdoor racket sports play? And I'm thinking particularly the tennis and pickleball. not necessarily contact sports, but on the other hand, you're exchanging, the ball's going back and forth, you're handling it and things like that. So is there any out there at this time? Any guidelines? Thank you.
Mr. Blumenthal, to the best of my knowledge, no, at this point. We'll be happy to take a look at that, though, as we move forward.
Thank you.
Other comments, questions? Okay, I don't see anything online either from that standpoint, so.
There's one from Mrs. Dahl.
Nicole Dahl. Ms. Dahl, go ahead.
I missed the email. I know that you said all of this checklist is available online. Could you possibly put in the chat the link to it so we can find it? Just because a lot of the stuff's going to take some planning on our end, ordering signage and making sure everything's spaced. And then also, sorry if I missed this again, what is the date when we're allowed to reopen the pool? Do we have that?
Ms. Dahl, that's the bane of my personal existence at this point. We have pushed the state as hard as we possibly can to try to get a date in terms of when pools could reopen. The governor was conducting another call today at 2 o'clock. Don't know if he'll shed any light on that, but we certainly anticipate an answer very soon. We, through the Arizona Lodging Tourism Association, sent a letter yesterday to him asking to open prior to Mother's Day. We hope that that's the case, or at the latest prior to Memorial Day, but there is no set date at this point.
And Brent, if I could follow up quickly. Again, we do not have all of the publications up yet. We will soon. But as I hope you know, when you go into the website in this committee, you can leave us comments or questions or notes. If there are any specific documents that you think would be very helpful for your industry to have in English and in Spanish, particularly, please make a note of that, and we'll make sure we get that done.
Ms. Budd, go ahead.
Okay, there we go. Sorry, my phone went to a different screen. I just wanted to check and see the same thing as far as the pools go. Do we have a date or even a time frame in mind? And do we know if there's going to be like a phased out opening of gyms, or are we all still lumped under one bracket? Because last we've heard from the governor, there wasn't much updates as far as that go.
Dr. Garcia, please correct me if I'm wrong, or Ms. Lesher. My understanding is the only pools, that type of thing, that are open at this point would just be home pools at your personal home, nothing else.
Chairman Durad, you are absolutely correct. Same thing with regards to gyms. At this point, we have not gotten any guidance yet from the state. We're simply trying to anticipate what we certainly believe will happen eventually, and that is the purpose of trying to start to develop this guidance.
Thank you, Dr. Garcia. Anyone else? Comments, questions before we move on? Ms. Calhoun.
Here, per se, so that is what I'm looking for some clarity on.
Specifically, in terms of which aspects?
Physical distancing, occupancy, any recommendation or any conversation that might have taken place during your task force. Ms. Letcher.
Dr. Garcia, was that discussed specifically at the task force?
Chairman Durad, Ms. Lesher, no, that did not come up. What we have started to think through is the 10%, not 10%, the 10-person occupancy as being a maximum. But again, this is one of those areas where we're waiting for guidance from the state before going much further. But since it was not discussed by the task force, I didn't feel we could just add it in ad lib.
Thank you very much. I appreciate that.
If I may, Ms. Calhoun, if there's a way you can get us some suggestions as well, because I think in addition to social distancing, obviously there's equipment, things I used to be familiar with, and kettlebells and weights and all sorts, and mats and things. If the industry could provide us with any of the suggestions for best practices and standards as well, we'd love to.
Absolutely, Ms. Letcher.
Thank you.
And we'll get you to one of our classes for sure.
Any other comments or questions? Okay, hearing none, let's move to attractions and tourism. Ms. Frisch, Ms. Strickland, thank you.
Thank you. We had a large and very diverse task force. What came to light is specifically we have two different categories that will need consideration, those that are indoor facilities and those that are outdoor. There's also a third category that is an outdoor with indoor facilities. So they're dealing with not only outdoor attendance, social distancing, but also indoor conference rooms, meeting rooms, restaurants, all of those. So they may have double the responsibility of either opening or closing conference rooms, social distancing and a lesser occupancy for restaurants, and then for any rooms that they're renting that it would be conference or meeting rooms. We're looking, what became very clear as we talked to the task force was the financial implications for ticketed events. If you can't do social distancing within ticketed events, it's going to be very difficult to have large crowds. Then it becomes a financial consideration. Can you manage to do a large event that's based on getting a good turnout if you're implementing 50% or less of social distancing? So those will be difficult things. For those venues that are outdoor events, if we open within the next 30 days, we have a heat factor to deal with. Can't have people standing in line. If you're taking temperatures of guests, if you would, they're going to be elevated. So do you have a cooling area? Will you just take temperatures for staff and have somewhere that's provided for guests as they wait? The other consideration, another one that came up, was pre-sale of ticketed timed events. So instead of being able to show up, buy a ticket, and go to an event or a venue, you may have a pre-sale so you can control your attendance, and it may be a timed ticket. So you arrive at 10, you have to leave by 12 or 1 o'clock. To take care of that, how many people do we have within the venue and how are we social distancing them? There were concerns for, particularly for events or venues that have children. How do you control and separate children, or how do you wipe down and clean those attractions or those venues that they're using? Or do you close that portion of your attraction until you can figure out a way to, again, clean, sanitize, and open it again? For those venues that have volunteers or docents, the security and safety comfort level of those volunteers is very important. For those who rely on a full staff of volunteers to help run their venue, do they feel comfortable and will they return? If not, how do they approach that and make them feel comfortable? Or some suggestions was if they're in a protected category, an older, more vulnerable group, can they find a younger or more protected category or people that would be willing to work for them? Those were some of the suggestions. Marketing and communication is certainly going to be a challenge if you're spending all your money on PPE and you've traditionally have the majority of your budget in marketing. You're going to run out of money or you're going to have difficulty with money. How do you begin to market and let people know that you do have changes? What has always been in the past, a walk-up ticket may not be available. So there are quite a few things that the attractions are struggling with, trying to figure out what is the best option for us, and depending on their size, their volunteers, and their financial situation, they're looking at all of that to when they would open and if the guests would feel comfortable in coming.
Ms. Frisch, thank you so much. Appreciate the overview there. Want to open it up. Any questions, comments regarding the recommendations on attractions and tourism?
Chairman Durad and the members of the committee, Administrator Huckleberry and Lesher, thank you very much for including, I'm Curtis McCrary with the Rialto Theater, including us in this process and discussion. Obviously, it's a very important thing to work through. My question is not specific to attractions and large event venues, which is the subcommittee that I'm on, but instead is more of a big picture question. And we've covered this already, but I kind of want to drill down on this particular point. We've established that the county feels that its hands are tied by the governor's timeline and his executive orders, despite the fact that that timeline is in conflict with the recommendations of public health officials and scientists at the University of Arizona, as Dr. Garcia established earlier, that their recommendation was no sooner than May 31st that we reopen. Are there any circumstances under which, if cases spike, there will be pushback from the county to the state? Related to that question, I'm curious about what the communication has been between the county and the states and the governor's office beyond adherence to the executive order. And then finally, I would like to know, based on the fact that there have been reports that in places where there has already been reopening, and from my perspective, that's entirely premature in many of these places, case numbers have increased. And in fact, if you look at the entire United States, excluding New York, New Jersey, and the Connecticut metro, cases are currently on the increase. We established in our subcommittee meeting that you can't wall off Pima County from the rest of the state or the rest of the country. That's just not how it works. If the county's hands weren't tied by the state, would the recommendation of county administrators and Dr. Garcia be that we should be reopening Monday? Thank you.
I think we've been fairly clear we probably would not, but we do not have the authority to do so.
Let me also mention, one of the parts of the questions you asked was, we been in touch with the state? There was a period of time, they ended recently, where County Administrator Huckleberry and I and Dr. Garcia and others were on a call. I believe it started daily. I could be wrong, with the governor's staff. We met with the governor's office every day. It went till about 3 days a week. Mr. Huckleberry has been writing to the governor and as well as to our congressional delegation. We were writing to the senators and to the Congress members to try to get assistance particularly in testing and PPE. And making sure that those supply chains come into our area. But our communication with the governor's office has been consistent, and we are now looking at a shared letter that we've been drafting that's with Maricopa County, Pima County, and the 3 largest jurisdictions being Tucson, Phoenix, and Mesa, in hope that those communities can come together, because part of our concern, particularly in Pima County, as you know, it's very difficult for us to make, if Tucson makes a rule or Valley makes a rule and Sahuarita does not, it is extraordinarily problematic for many of our organizations to figure out where those lines end, and can people cross the street and have a meal there but not in your area? So how do we provide the global jurisdictions, and which is why we as a subdivision of the state have been following that guidance but pushing as hard as we can in daily conversations. Our calls have been with the governor's office. I know Dr. Garcia has continued more than daily calls with the Department of Health Services, Dr. Christ, and the folks in that department as well. And I don't know, Dr. G, if you want to elaborate on that at all.
Chairman Durad, Ms. Lesher, sir, we have been very, very consistent about the need to make sure that whatever strategy the state uses in terms of the reopening, that it should be a statewide strategy that is informed by the best data that there are. People will look at the same data and come to different conclusions, and we understand that. But I think that there is a broad agreement across the different counties that you cannot do, given the impact of Maricopa County by itself on the entire state, that solutions that are made by county basis are not likely to be successful unless we build checkpoints at our borders. So we have advocated consistently for science-based kind of decision gates that will allow us to move forward. Having said that, we do know that there are many other considerations that need to be taken into account in terms of when you open. Our communications with the State Department of Health have been, on a near daily basis, either on the phone, on webinar, by text, and by email, even on the weekends, with both Kara Christ and her deputies, as well as the governor's policy advisor. We have made our position clear, but we also understand the limitations of the position that we're in.
Thank you, Dr. Garcia. Are there any other comments or questions? Ms. Kluge?
Thank you, Chairman Durrett. Thank you, Mr. Huckleberry, Ms. Lesher. The task force, I just want to note that this was very helpful to us in setting these guidelines for when it is the right time and when it is safe to open. It doesn't happen overnight that we order lines for queuing and be able to train our staff, order signs, order disinfectant, and so having this guidance is very helpful. So I want to commend the county for taking the lead in setting these guidelines so that we can be ready when the time is right. So thank you for getting that preparation. We do look at wanting safety for our staff, safety for our guests, and to be conservative and take it slow. And I think these guidelines were very helpful to us for planning to do so. So thank you.
Thank you, Ms. Kluge. Anyone else? No. Craig Ivani. Mr. Ivani, please go ahead.
Thank you, Brent. I'm curious, I've heard an overview as far as attractions, and I've also seen the guidelines document, but I haven't seen best practices for attractions, and I'm wondering if there's a document that has to be prepared that I haven't seen for that, or if there's going to be one that will be forthcoming. And then a separate question, from Tuesday's meeting, there was a conversation about what could be open and closed, and in particular, water fountains is one of the things that was brought up. And while I certainly understand the concerns about water fountains, I also will go back to that concern about heat. And I'm just wondering if there's been any further consideration of water. Thank you.
Let me answer that question. Obviously, when you looked at the evolution of these documents as they're being developed, one predates the other, and et cetera, so one's further along in advancement, and so that's why you see best practices. One of the things that we will have to do now is go back and make all of these documents consistent with regard to language and practices and standards and things that, in one document we'll talk about physical distancing, but we won't talk about the separation, the markings, the 6 feet and all that. So all of that's got to be redone and become consistent. I think the question on water fountains is probably still one that we hadn't addressed in any great specificity. And so I think what we need to do is go back and look at the potential danger of multiple touches on a water drinking fountain as opposed to simply turning it off and providing bottled water. I think unless you can have someone stand there and wipe down the handle or the button, it's problematic.
Mr. Ivani, does that answer your questions, or do you have anything else?
very much thanks for the opportunity to speak as well as addressing those questions.
Thank you. Anyone else? Ms. Calhoun.
Thank you, Mr. Durad. Kate Calhoun, Tucson Convention Center. So I appreciate the conversation that we had during our meeting on Tuesday, and I'm looking at the documents that Dr. Garcia had recommended that we take a look at, the White House documents and the governor documents. Specifically, I'm looking at large venues. When we get into phase one, we can open up sporting venues, and then we can operate under strict physical distancing protocols. I think most of you all know that we've got some events coming up in the near future in June. One event in particular that I'm asking about is Jim Click Automotive, where they have approximately 200 guests, but they've got 400 cars in our exhibit halls. And so I know we have to get to phase one, but I'd like to get direction from the county, from Dr. Garcia, on how we can execute this. And then I'd like to be able to go to my leadership team with the city of Tucson, who has our contract, to get their blessing as well. Thank you.
Other comments or questions? Ms. Gallego, please go ahead.
Hello? Hello?
Hello, yes, please go right ahead, Ms. Gallego.
Oh, great. I apologize for the delay. I have two questions. One is very specific, related to COVID transmission, but overall, as we imagine that our workforce will grow in terms of employees going back to work, have there been any guidelines or considerations for employees' ability to show up to work because their children are not going to be in school for any foreseeable future? I'm just wondering if that's going to create what considerations in terms of equity models we might be considering and we might be able to model for people that are able to work remotely now, for example, but may not have the freedom to, leave their children by themselves if they do have to show up to work. What kind of protections or guidelines do we have in that respect? And then my second question was just a real practical one. What do we know about COVID transmission via pools?
Dr. Garcia, you want to take the water issue first?
Sure. Ms. Lesher, ma'am, I can tell you that water, so pools in general are not going to be a transmission source for COVID-19. That needs to be caveated with certain water features, for instance, splash pads that generate droplets, that generate spray, may potentially represent a hazard. So the jacuzzi may be a problem. The regular pool, lap pool, will likely not. And the guidance from both the CDC and OSHA is evolving. Neither of them probably represent significant transmission risk, but clearly jacuzzis and things that generate aerosols like splash pads are higher risk than the typical pool.
And Ms. Gallego, let me take a stab at the first. And we actually have another committee that's looking at business and employee health and wellness, and is trying to compile data that we'll have on the website and to be able to share. If you've not had an opportunity to review all of the documents related to Emergency Family Leave Act, all of the federal guidelines, I think every employer is doing things a little bit differently. There's a variety of pandemic leave options and medical leave options, and then again, a variety of options that relate to the provision of leave time, specifically to address the issue of child care. So while it has not been specifically addressed by this group, others are looking at it, and we will share what all the various state and federal guidelines that exists through the website.
Other comments and questions? I had committed to Danette Bewley. She's the CEO for Tucson Airport Authority. She sent me a note, and she just wanted me to relate to everybody. Commercial traffic is down 95%. Let's see. Airline schedule projected to climb slowly, but we may still be down to the 50 to 60% mark over the next year. They're exercising extraordinary cleaning protocols. We'll initiate a campaign to market to consumers, trying to earn their confidence, and that, again, the airport remains open as a critical service and is in no jeopardy of shutting down. Wanted to just, again, go back one last time. I'm just checking electronically here to see if there's any other notes. But Michelle Conklin, I know you had your hand raised down there at the beginning. Didn't know if maybe your point was for the attractions and tourism. Just wanted to see if you did have a question or not.
Yes, I do. Thank you. I just want to make sure that it seems to be that restaurants and pools, the are formulating with some real definitive guidance for the attractions. Will there be real definitive guidelines for, especially for our frontline staff? Will masks be required, or are they just a recommendation? There seems to be a lot of gaps right now, and I know that my staff this morning, before they come back to work, they wanted to know what were those rules and regulations. Thank you.
Michelle, we will be providing, again, developing all of the best practices and standards that we're recommending for, as this committee has been created to wrap together all the information from the three groups. You will be seeing very soon on the website all of the compilation of the best practices, and it will include the information you need for your employees, we hope, at the at places like Botanical Gardens.
Thank you.
Are there any other comments? Okay, hearing none, let's go ahead and move forward. Just looking at the recommendations for the steering committee, we've got operational procedures, educational collateral materials, recommendations for community education and communications. Let me start by asking you, Ms. Lesher, and you, Mr. Huckleberry, any thoughts or comments in terms of this, or do you have the, I guess, the feedback that you need at this point for the steering committee? And I'm obviously more than happy to participate and present any of that as we move forward.
Yes, I think we have it. One of the things, again, we're going to spend probably tomorrow and the weekend making some of these documents very consistent. And you got to hunt for it, but in the attractions it does talk about, I know the last question, but it talked about the staff and volunteers wearing masks. And so if that's not real evident, we need to figure out how to make those things evident in these documents and make them consistent. So we will do that. I think we have all the material we need to basically come up with what we call another iteration. And so I think when we talk to the full steering committee on Monday, we will have full iterations of this and many of the other things to give to them, and hopefully decide where we go from there, and then how do we put these things into practice, and how do we then talk about the appropriate communications and signage and documents that all have to get to everybody who has to start to put this in place so that we get consistent messaging. And so one of the things that we heard, I think, quite often from our business and employee health and wellness group was we need to have very site-specific, consistent messaging that can be understood by everyone. And so we're working on that even today. And so we'll roll those things out too for feedback, because again, nothing's going to be finalized until everybody's had their say. And so we're about 3/4 of the way through that. And again, we've had to move this process fairly quickly because of the estimated opening dates on certain things that occurred and is occurring as early as Monday, the 11th.
And I might just add, the work of the three task forces, again, come into this committee, and Ms. Erickson and Mr. Durad serve on the steering committee, so that hopefully the voice of all of you is brought to that steering committee, so that there's the continuity and that messaging. If you have into the website, there is an opportunity for each and every person to comment directly to each committee, so that we can get that feedback as well. And as Mr. Huckleberry has noted, our job this weekend is to take all the different pieces. We end tomorrow, I mentioned, with the communications group, because we think everything we say and do then needs to be communicated first to the local public, to let the community here know that we're coming back for business and they can feel safe and confident returning to our local attractions and bars and restaurants. And then eventually we'll be ramping up into the summer, and we hope for Tucson Airport Authority and everyone else will be taking a message globally that Pima County is back open for business. So it's not going to be resolved tomorrow, but we'll be launching those activities. Any comments and feedbacks we welcome. But again, just know that you have a voice in your two co-chairs here on that steering committee as we continue to make all the, to continue the discussions.
Any additional comments? Okay, no. So at this point, I just wanted to again reiterate, thank you so much. We really appreciate all the input, everything that you've done to again provide the guidance that we need to put forth those best practices in a way that will help all of you, not only to reopen, but to keep your employees safe and also to keep your customers safe as well. This is absolutely vital. Again, my thanks to Pima County. Thank you for stepping up to make this happen. We need to provide some specific guidance. It really hasn't come forth from the state. That's my personal opinion, and so I feel like the county stepping up and being able to provide these strong recommendations and best practices is really important to all of us. So thanks again for all of your time and your input. We appreciate it very much. If anything else comes up, again, I believe the steering committee meets next Tuesday at 2 o'clock. Please feel free, whether it's through the county staff, or if it's me, I would love to take any additional input that you may have. So my thanks to all of you.
I'm going to interrupt you for 1 sec. Just say the steering committee meets Monday at 2 p.m., so call Brent on Tuesday, but it'll already have happened, so give him a call before Monday. Thank you.
Thank you. I appreciate it. Thanks for the clarification. Anything else? Okay, we are adjourned. Thank you.
Thank you.
Thank you.